breaking speed. I'll be honest, not everyone was confident it could be done. But here we are, a year later, announcing an astonishing $3.3 billion in funds to transform California's behavioral health system. This is a generational investment in California's behavioral health future. It shows that California cares deeply for people suffering with the diseases of mental health and substance use disorders and will stop at nothing to get them the care they need. And the grantees we celebrate today have shown a tremendous amount of will and urgency. Right now, there aren't enough options for specialty mental health care, so kids in rural communities and counties must travel across the state to get specialized care, away from their families and support networks. There aren't enough beds to care for the overwhelmingly number of individuals with substance use disorders, so they must wait for care and sometimes end up living on the streets. There aren't enough behavioral health providers who reflect the diversity of our state, that speak the same language and provide culturally or linguistically responsive care. The grants we're announcing today are designed to change that by building and expanding residential beds and outpatient care in local communities that need it the most. California's rural communities, California's sovereign tribal partners, California communities across the state that need these facilities to provide care to your neighbors, your family, and maybe even directly to you. Incorporating mental health and substance use disorder services together in facilities or on the same campus so people can access holistic care without navigating fragmented systems, and serving Medi-Cal members in all of these new and expanded facilities. Over the next 30 years, these facilities will change millions of lives. More people will have access to timely, appropriate, and culturally competent care. More people will be able to receive compassionate, evidence-based treatment in times of crisis, potentially reducing the number of individuals incarcerated or hospitalized unnecessarily. And more people will heal and live in long-term recovery from these diseases. Beyond the immediate benefits of behavioral health services, these bond dollars will also boost local economies by creating jobs related to the expansion of treatment settings and support local businesses involved in facility construction and operation. This funding is about providing immediate, effective care to individuals in crisis right now. Over time, this will result in a more sustainable, high-quality behavioral health system, helping to reduce the stigma around mental health and substance use disorders and improving overall public health outcomes. I am tremendously proud of the DHCS team led by Marlise Perez, our grantees, and our state for this historic investment in our behavioral health system. Again, thank you for your work to make this vision a reality. Now I would like to turn it over to Dr. Matthew Chang, the Behavioral Health Director of Riverside County.
Well, thank you, Director Boston. Good afternoon. I'm Matt Chang, Director for Riverside University Health System Behavioral Health. On behalf of Riverside County, I'd like to thank Governor Gavin Newsom, the California Department of Healthcare Services, and everyone who helped bring this vision to life. Your leadership and support will save lives. Riverside County is one of California's fastest growing regions, and our behavioral health system is working to keep pace with the steadily increasing population. In a rapidly growing county of nearly 2.5 million residents, many individuals experiencing crisis are stuck waiting in emergency rooms or must travel far from home to find care. This shortage delays their recovery and separates them from the support they need most. Our new RUHS Behavioral Health Wellness Center will play a critical role in improving access to psychiatric care. This pioneering facility will include 100 psychiatric beds dedicated to adolescents and adults, along with children, providing the first and only beds for children under 12 in Riverside County. Located directly next to our RUHS Medical Center, the Wellness Center will quickly connect people to the right level of care and specialized treatment. Designed to modern standards with tranquil and secure outdoor spaces, it will offer a safe, healing environment that supports recovery and restores dignity. Our second project will be located at the Riverside County Harmony Haven Children and Youth Center, a transitional shelter care facility that provides 24-hour care and supervision for displaced youth. Too many young people facing mental health and substance use challenges in Riverside County have lacked comprehensive services. The services at Harmony Haven will be available for children and youth ages 0 to 18, and will include the county's first 30-bed adolescent residential substance use disorder, a 16-bed psychiatric residential treatment facility, a 15-slot mental health urgent care, and an outpatient clinic for behavioral health and substance use services. All of these services will be offered in one coordinated, compassionate setting, developed through close collaboration with child welfare, probation, schools, and other county partners. Harmony Haven is designed to give youth and families access to the care they need without having to leave the county. Together, these projects reflect our commitment to safety, health, and recovery. They will provide Riverside County residents with access to compassionate, effective behavioral health care. Thank you again for believing in our community and for helping us build a stronger, healthier Riverside County. I would now like to introduce Vitka Eisen, CEO of Health Right 360.
Thank you, Dr. Chang. Those sound like really exciting projects. Good afternoon, everyone. I'm Vitka Eisen, President and CEO of Health Right 360, a not-for-profit healthcare organization providing care to low-income Californians with behavioral health conditions for over 50 years. On behalf of all of Health Right 360, I want to thank Governor Newsom, the legislature, the Department of Healthcare Services, and our many partners across the behavioral health continuum. And to the people of California, thank you for standing behind the urgent need to prioritize behavioral health care in every community. As someone who has worked in the field for decades, and as a former drug user and beneficiary of California's safety net treatment system 40 years ago, I've both lived and witnessed the power of a safe, dignified space to change a life. I know the importance of safety, dignity, and compassion in creating space for people to take the brave and sometimes scary steps towards improving their lives. When someone walks through our doors and feels seen, respected, and supported, it's not just treatment, it's healing. And how that individual is greeted, what that space looks like and feels like, plays a critical role in determining whether they stay and become engaged in care. That is why these Prop 1 infrastructure projects are so critical. This is a once-in-a-generation investment in the whole health of our California communities. Today's behavioral health continuum infrastructure program awards are more than an investment in buildings. They are investments in Californian lives and future. These funds will expand capacity and support more timely, effective, and culturally responsive care. This means reaching communities that may have never had access to local services. And it means delivering care that's closer to home and responsive to people's unique needs and lived experiences. The Health Right 360 projects funded in this first round of Prop 1 funding will result in increased capacity for residential substance use disorder treatment and integrated withdrawal management services for individuals with addiction and co-occurring mental health conditions. Our two projects together, located in Ventura County and Santa Clara County, will allow us to serve over 1,000 new individuals per year in communities with unmet needs. This progress is only possible because of the extraordinary people who deliver care every day, our compassionate, skilled, and unwavering behavioral health workforce. They are the heart of the system. California, as always, leads the way, showing what's possible when we invest in equity, evidence, and innovation, and when we treat behavioral health as a shared priority and responsibility. These efforts are strengthening a system where everyone in California, regardless of income, geography, status, gender, or background, can access care. This isn't just about beds. We're building belonging. And now I'd like to turn it over to California's Secretary for Health and Human Services, Kim Johnson.
Thank you so much, CEO Eisen, and thank you for sharing your story with us. And congratulations to Health Right 360 and Riverside County on these exciting projects. Building more treatment options means California is making it easier for people to receive the right care at the right time and in the right place. By focusing on prevention, early help, comprehensive services determined by need, and long-term recovery, Californians will be healthier and our communities stronger. This work is one part of a larger plan in California, which we call Mental Health for All, and it is building a stronger and more equitable behavioral health system. The goal is to make sure every Californian, especially people who have the hardest time getting help, can get high-quality mental health and substance use treatment when and where they need it. This plan is supported by major investments, new policies, and close partnerships with local governments, health plans, care providers, people with lived experience, and community organizations. Today's awards demonstrate we are on this journey of transformation together, building more care for Californians. To date, the total state investment in these behavioral health interventions is over $14 billion. With these interventions, we are improving care experiences within the healthcare delivery system, including faster access to providers who speak the language and understand the cultures of who they are serving. This includes certifying over 1,500 wellness coaches and embedding peer specialists into our Medi-Cal program. We are also contributing to a higher quality of life as more people are receiving timely support for untreated mental health and substance use challenges, leading to better outcomes in schoolwork and daily life. These include investments in employment services and an increased focus on treating substance use disorders, like you just heard from Health Right 360. We're working toward meeting the needs of young Californians as well. The Children and Youth Behavioral Health Initiative has increased access to school-linked behavioral health services and launched free coaching services with qualified behavioral health wellness coaches. These investments are also intentionally integrated to expand access to effective care, reducing overdoses, and addressing homelessness. We've created or enhanced over 450 mobile crisis teams. The CARE Act process is preventing more restrictive conservatorships or incarceration for those with serious mental illness from the start. Unlike in many other states, homelessness rates in California are stabilizing. California has invested over $1 billion to fight the opioid and fentanyl epidemic. Naloxone is now available for free or reduced prices for eligible organizations. And last year, the number of reported drug overdose deaths in California dropped by over 20%. Today, we celebrate that we are building more treatment settings and community-based care with new inpatient, outpatient, and residential programs, like you just heard will be the case in Riverside County. Thanks again to Director Boss and the team at the Department of Healthcare Services for not only their timely and thorough review with the award process to get these Prop 1 resources into communities, but also for their focus on accountability. California is setting clear, measurable goals to track progress. State and local agencies are required to monitor service effectiveness, report outcomes publicly, and demonstrate how funds are being used. This focus on data, transparency, and community input will ensure accountability and drive continuous improvement across the system. Together, the Prop 1 Bond Act with the Behavioral Health Services Act, which focuses on the delivery system, will build on California's broader efforts to reimagine and strengthen the entire behavioral health system, connecting services, expanding access, and improving outcomes for all Californians. And now it is my pleasure to turn things over to a phenomenal champion of behavioral health transformation, Governor Gavin Newsom.
Thank you, Madam Secretary. I love that presentation and the enthusiasm and your passion, and more importantly, all the action you and your team have taken in this space. I want to thank Director, thank you, Michelle, thank you, Dr. Chang, Matthew, thank you for your leadership. Victor, thank you for joining us here today, and all of you that have taken the time to be here. We have been impatient, speaking of time, and this last year, we were very intentional about our desire to get to this moment as quickly as we possibly could, mindful that the public is exhausted by the conversation around behavioral health, conversation around homelessness and the challenges that we face, not just here in California, but all across this country. They wanted to see action. They want to see results. They wanted to see a kind of intentionality that they haven't seen in the past. And that's what we promised with Proposition 1. That's what we promoted during the initiative, a $6.38 billion bond that was committed to rectifying and reconciling the failure of the past, decades and decades of neglect to address the needs of hundreds of thousands, not millions of people that are struggling all across our state from mental health and substance abuse disorder. I want to just briefly, as I have in the past, but I think it's so important to punctuate a context to the moment we're in and where we were. In 1959, at the peak of the number of hospital beds in the state of California, 1959, we had about 37,000 beds, locked beds. Today, it's a little over 5,500. 37,000 in 1959 for a population half the size that it is today. And today, a little over 5,500 locked beds. Now, what we're trying to do is not replicate the conditions that led to a bipartisan effort to move away from those locked beds and a process that unfolded over the course of decades around deinstitutionalization, but to be mindful that the vision of community-based care, the alternative to those locked facilities, was never realized. And that's what we set out to do over the course of the last many years. Frankly, this goes back to 2021, when there was a study that came out from the RAND Corporation that not only highlighted RAND, that bed count that I just referenced, but also highlighted the need, 7,800 gap, 7,800, not just residential slots and beds, but the critical imperative of doing outpatient and treatment slots in this state. We highlighted that. At the same time, we highlighted at the time significant budget enhancement, some $1.7 billion that we put into the budget that year to begin the process of addressing that need, to address the importance and imperative of acquiring, rehabbing, and constructing new facilities and providing more support for treatment and slots. We were successful that year in advancing that request of the legislature and advancing our efforts to try to make up for the last few decades of neglect. But it was clear that on the pace we were at, with the general fund being limited in terms of its capacity to deliver in a bold scaled promise and to ultimately try to substantively address that gap that Rand and others had highlighted, that we needed to do something bigger. And that's what led us to Proposition 1 and led to the voters enacting and supporting that $6.38 billion bond that promoted 26,700 treatment slots, again, 11,150 new beds. But they also promoted reforms. And we said we're not going to do business as usual, that we're going to do CEQA reforms. We're going to bring that sense of urgency in terms of how we architected that request of the voters. And so here we are. And I can assure you, what's historic is not only the investments, the scale and scope, but the time to delivering now on these investments. And I'm not naive that this is stage one. This is the beginning of the end of the first phase process. And now the second phase process begins. But let's talk specifically, let's put up some slides on what we're doing today. Today, we are putting out not notice of funding availability. We're not saying $3.3 billion available. We're saying $3.3 billion is going to be distributed to 124 projects throughout the state of California and supporting 214 new facilities. You will see that almost every part of the state is included. 54 of the 58 counties will be receiving this unprecedented support. Almost 5,100, it says 5,000 residential treatment beds, just shy of 5,100 beds are going to be procured in this process, and over 21,800 outpatient treatment slots. That's over 80+% to goal. And this is, again, just $3.3 billion of the total $6.38 billion. Here is the key slide. All of these projects that we assessed, and there were hundreds and hundreds of projects that we did not fund, but and by the way, a lot of them are good projects, but many of them were simply not where we needed them to be. They were not sites that were controlled by the cities or counties. They were not launch ready. There was no way we can extend a contract and execute it within 90 days. And they weren't going to be the beneficiaries of the CEQA exemption. In every one of the cases, all of the projects that we are promoting and highlighting today, we have site control. They are launch ready. They're ready to extend the contract in the next 90 days. If they don't, we're not going to get them the money. And they're all going to take advantage because the voters were wise enough to include CEQA exemptions so we can get these damn projects built in real time. Now let's talk about some of these projects. You see here a project that, based upon the application based upon our assessment of the application and all of those criteria that we can see operationalized later this year in December. This is the Heritage Regency site down in Orange County. You can see a site here, September 2026, that we want to peg for a completion date down in LA County. Another LA County project here in May of 2027. These are renderings of the sites that have approved and projects that we are now funding that are going to take shape. Here's additional project for June 2027 and a remarkable project here at Tribal Wellness Village in 2027 as well. You'll see another in LA County, San Pedro, a behavioral health center, May 2028. Again, renderings of some of the projects. I'll just give you one more, an important one. Thank you, Dr. Chang. The RUHS Wellness Center, that project that's slated, and you saw the total scope of it. Again, this is a plot of land now, and or small pieces of a puzzle that will really develop this mosaic that you see here. And so that's what we're doing today. But we're also want to remind you of what we're doing, not tomorrow, but next year, in pursuant to the will of the voters. They wanted more time, and we gave the counties more time under Proposition 1, and that was to completely reimagine the Mental Health Services Act. And we did this with the original author of that act, former Senator Steinberg, Mayor Steinberg, and the voters approved a new strategy to create ongoing money by July of next year, this integrated behavioral health plan that requires more accountability, more transparency, one simple plan for every county, auditing components, again, holding taxpayer dollars to account with more transparency so we can hold counties and cities to account. 30% of that Mental Health Services Act money now must be set aside. It's roughly $1 billion a year. It fluctuates on the basis of tax collections. 30% funding for housing needs for people that are broadly in this category that we are funding the capital. So this is a game changer. This will be the ongoing funding that cities and counties need, this unprecedented capital funding that addresses the need. And the fact that we're moving this $3.3 billion of what is currently captured as a $4.4 billion plan, which begs question, what about the other $1.1 billion? We're done with the slides. We have those dollars going out in just a matter of weeks, and they'll be highlighting the availability of funds for the additional grants. And again, there are a number of people that weren't recipients in this first phase. They'll still have a chance in phase 2. And as I said, those that didn't meet the criteria, we're not interested in not interested in funding, I should say, past practices. We are all about partnerships that get things and get things done and understand the imperative and the frustration that many of us feel in this state around addressing this critical issue. I also should note that's $3.3 billion that we're putting out. The 1.1 will have the notice of funding availability as part of this component part of Proposition 1. It's a $6.38 billion bond, of which roughly $2 billion comes out of what we call Home Key Plus. Home Key, which has been really extraordinarily successful program for the state of California, has the zoning and land use reforms component parts. That includes about $1 billion for vets, which is a point of deep pride, by the way. California led the nation in the biggest reduction of veteran homelessness last year. And I appreciate what Secretary Johnson said as it relates to homeless growth. The unsheltered population grew at 0.5%. There are 44 other states that had faster and higher growth than California. We're finally seeing some stability in this space. We're not for stability. We want to see significant reductions. But we are finally, this flywheel is finally taking place in shape, but the needs for beds are overwhelming. And that's why we're so excited about today's announcement. And now it's about driving these projects to completion. And that's the final point I want to make on this topic. It is critical now that local government does everything in its power to address local permits. California has done everything it can, and Californians have done everything they can as it relates to providing these exemptions to CEQA and moving these projects, the project dollars, and identifying the projects in unprecedented speed. But localism is determinative. The state vision will be realized at the local level, and that's why it's incumbent in the 54 counties that are participating in the benefit of these funds that we drive local accountability and we drive local support to get these projects permitted and deal with that last proverbial mile to finalize and get these projects open and operational. So deep pride, deep gratitude to the voters of California that entrusted us with the biggest investments of any state in American history. This is the most exciting work that's happening in the United States of America on mental health and substance abuse and behavioral health reforms, period, full stop. You combine this with what's happening in our reforms to the Medi-Cal system under CalAIM. You combine that to what Secretary Johnson was referring to in our unprecedented multi-billion-dollar, unprecedented investments into prevention and focusing on early screening, 0 to 26, the investments we're making in care court, conservatorship reforms, driving more accountability across the spectrum of other issues related to homelessness, and ongoing funding for housing. This is a really pivotal time in California's mental health history. And as I said, if we can go back in time, we would not have made the mistakes that were made in the past, but we're working with a sense of urgency to make up for that. And again, everybody that spoke is a big part of that. And everybody that's out there that are receiving the benefit of these dollars will be the most important part of that, delivering on what we're promoting and promising here today. So that's the overview. We're happy to take any questions on this. And just one final point on the HomeKey Plus, those announcements will come in a matter of weeks. We believe the latest first, second week of June. I'm trying to get those announcements a little earlier. So that will get us, I mean, we'll pass the goal that we said in terms of identifying the units in housing on slots as well. And we'll get that, you'll have clarity on what the details are of that in just the next few weeks. So anyway, points, I'm passionate about this. I care deeply about this. This is, if there's any unity agenda, there's no politics here, rural, urban, north, south, all of us in this together. It's the issue of our time. And we're not taking our time. We're addressing this crisis with that sense of urgency that you deserve. And everyone listening, I think, deeply understands in their core. Now happy to take any questions.
If you are a member of the media and you would like to ask a question, please click the raise hand icon at the bottom of your screen and then unmute yourself when called upon. Again, if you would like to ask a question, please click the raise hand icon at the bottom of your screen and then unmute yourself when called upon. Once unmuted, please state your name and outlet, and if your question is for a specific person, please indicate that. Our first question goes to Alex Michelson. Alex, please unmute yourself.
Hi, Governor. This is Alex Michelson from Fox 11 Los Angeles, and my question is for you. Who exactly are going to be in these beds? How do you determine who that is? Is it care court people who may not necessarily want to be there? Is it people that are coming on their own free will? And broadly, at this point, after so much work and so much money and so much has been put into this, what big obstacle do you have left? Or has this, at this point, sort of gotten through a lot of the obstacles and now it's time for execution?
Well, it's just about execution. And at the end of the day, now it's about local government doing their part. We've done our part. The people of California have done their part. Unprecedented supports gave us the opportunity to have these reforms enshrined through this initiative, and then told us if you're going to move with accountability and the kind of speed that's required. And we've done that. We've identified the sites. LA County is receiving over 25% of these dollars in just the first round. And now handing this baton off to local government? And the answer to your question is yes and yes. For those that are in care court, conservatorship, beneficiaries of all of these programs, county directed, not just state directed, alternatives to state hospitals. We want to keep people, as many people as we can, out of CDCR and county jails as well. And we also want to have a place to put people when they leave the county jails or CDCR, so they're not going out on the streets and sidewalks and encampments. And so this was, again, all that we promised and promoted. The final piece now is local permits and getting these construction project, rehab projects moving. But you saw some of those timelines. This is not all new construction. Some of the new construction is piecing together existing facilities and then building on top of them. There's some campus settings here, which are really exciting. There's a regional component to this to make sure we're addressing gaps in underserved communities. And there's, again, only a handful of counties that are not included, and those counties are part of a larger regional consortium, so they still have the benefit of these dollars.
I mean, how does this tie into your overall thought about clearing up encampments? I know there's news today on that front of you pushing local governments on this point. Is this adding to the idea of one less thing that there's an excuse on?
You said it better than I could. One less thing that there's an excuse on. We're flooded the zone in terms of support and resources. We flooded the zone in terms of reforms as it relates to zoning and land use. We flooded the zone as it relates to issues that have been vexing in the past about conservatorship reforms and creating a new strategy that we did under Care Court. We've answered every single call, including ongoing funding, which I've highlighted coming next July as it relates to the imperative and importance of housing, including, by the way, incorporating behavioral health and mental health and substance abuse, meaning to have the one-stop capacity of building a bed that does everything, is not segregated and siloed, as was the case in the past with funding streams that are now aligned. No more excuses, time to deliver.
Our next question goes to Ashley Zavala. Ashley, please unmute yourself.
Hi, Governor. Ashley Zavala with KCRA. And that actually tees me up to this question. And I want to just take a big step back. I understand we're talking about Prop 1 funds and what voters have approved. But I mean, for years now, there have been questions overall about the effectiveness of this system that's been in place, where the state is sending cities and counties money to address a problem, and especially when it comes to homelessness. You yourself have said, as mayor of San Francisco, you got not a dime from the state. And I'm wondering, like, at what point would your administration just no longer do this? And I'm not just talking about specific jurisdictions. I mean, everyone. Is that a conversation that your administration is having, or is that off the table?
Well, let me first start by complimenting those jurisdictions that are doing an outstanding job. And I should note, you saw that overall homelessness across the country went up 18.13% this year. You know, before I got here, we had a 5-year run where we saw a 50% increase in the homeless population. We finally tempered that, and that's the effort of local elected officials in partnership with community-based organizations and leaders of all stripes that are making progress. But it's not even, and there's parts of the state that frankly aren't even participating. There's a classic example of a community that refused to put $1 in to receive hundreds of thousands of dollars of state funding for a shelter. They've simply turned their back in terms of accountability and responsibility. Those dollars should come back, specifically in this case. They don't deserve those dollars. And I wonder, and I say this with respect, on the crisis of our time, I wonder if local representatives there deserve to lead the people of those communities when they're leaving people out in the streets and sidewalks, and the state has come in with unprecedented support. So my frustration is highlighted in those instances, but not in those instances where we have working partners in cities and counties that have really stepped up, and you're seeing some cases of double-digit decline in unsheltered population. Others where seeing runaway growth or seeing some stabilization, and they've asked for these additional pieces, particularly new beds. But no, look, this is not about more. No one wants to hear about more. They want to hear about how things are getting better, and they want to see it with their own eyes. And so when it comes to the street population, what's happening with tents and encampments, Alex's question earlier, to the broader issue around the quality of life in these cities, I'm not interested anymore, period, full stop, of funding failure. I want to see real results. And you'll see in my budget on Wednesday that we're going to hold the line. We'll work with the legislature as we did last year. As it relates to any additional money, we have to see a new criteria of consideration, particularly on the issue of encampments. That's what that EO, or at least the announcement building on my executive order that we just put out on encampments, represents. It is time to just disabuse ourselves that you can continue with the same talking points of 5, 10, 15 years ago. The state has changed, and so too now must the cities and counties. It is time to take back the streets. It's time to take back the sidewalks. It's time to take these encampments and provide alternatives. And the state is giving you more resources than ever. And it's time, I think, to just end the excuses and call the question. It's about accountability.
For those cities and counties that aren't cleaning up homeless encampments at sort of your direction, the rules that you rolled out today, I mean, will there be consequences? Is that what we could see in your budget?
Well, there needs to be, and we need to work with the legislature on any additional funding. And I think what you're seeing now with the homeless accountability unit, that's now part of the housing accountability unit, is the first enforcement mechanism the state has ever had more broadly. And I'll remind not you, because you understand it intimately, but others that may not. A number of years ago, California created a housing accountability enforcement unit. We started suing cities, and we started working with cities, not just sticks, but also carrots, in partnership. And we've unlocked thousands and thousands of units, and we've gotten a lot of cities and counties into compliance with what we refer to as the housing element. And the whole goal here is to do the same with homelessness. And I want to thank the legislature for just allowing us to set that up. And so that set the tone to your question of now how we approach things. But again, I'm just not interested as a taxpayer first, as a guy with 4 kids that wants to walk the streets, that wants to be in parks and playgrounds, someone who wants to see our communities revitalized and small businesses supported, to see the quality of life return in this state. I'm just not interested in this state continuing to fund programs that aren't fundamentally addressing that issue. If nothing else, let's get that issue addressed. And I'm proud. Look, Caltrans is not perfect. The state's not perfect. There's humility here. But we've numerically stress tested this. Over 16,000 encampments we've cleaned up at the state level. That's unprecedented in the state's history. We'll do more. We have to do more. We have a model ordinance that the state is using, and that's what now I want to see happen in other municipalities across California. Some have model ordinances that are unbelievably effective, and they actually enforce them. They've adopted them. Some, frankly, a little too extreme. You saw that even Fremont came back on a component part where they recognized they may have gone too far, and others are just nowhere damn to be found. Tulare County being a classic example in the case I gave you a moment ago.
Governor, the next question in the queue is from Aton Wallace. Aton, please unmute yourself.
Thanks, Izzy. Mr. Governor, thanks for taking the time. And actually, you answered some of my questions here already. You spoke pretty strongly about places you say have not lived up to your expectations. And you just mentioned Tulare County. So I was going to ask her to name names, number one. And number two, and I'm sorry to get a little bit off topic. Hopefully it's still on topic a little bit. You did mention the May Revise presentation upcoming this Wednesday. You've been actually very communicative at the Cal Fire presser a few weeks ago, and even before that at the lawsuit against Trump presser on the tariffs about the May Revise. You are concerned. Anything now that we're just a few days out, any kind of preview you can give us? Thank you so much.
No, I mean, look, we'll go through the details, and you'll have at me for a good hour plus. I'm sure there's a lot to share, a lot to communicate, but a little bit of previews. I'll start with some slides that level set on where this state has been, not slides today related to this announcement, but on Wednesday related to the budget in terms of where we were going on the revenue side, and then the impacts of Liberation Day to this state quite directly. And you'll be able to see for yourself the impacts of those decisions. Of course, today we woke up to the news, or yesterday, that the tariffs went from 145 to 80, because that sounds about right, to, well, now 30, but there's a 90-day pause. And the markets are reacting, and maybe they overreact to going down, maybe they overreact going up. That sense of vulnerability because of uncertainty for small businesses out there is real. The uncertainty, obviously, around making long-term, let alone medium-term investments, has only been amplified by this tariff recklessness. And you're seeing the impacts in the ports of Long Beach and Oakland, not just LA and Long Beach. So we'll highlight a lot of that as a preview and give you a sense of what that means in terms of our budget outlook for the budget year, what it's meant in the current fiscal year, and then in the multi-year.
The next question we have in the queue is from Ethan Varian at the Mercury News. Ethan, please unmute yourself.
Hi, Governor. Thanks for taking our questions. I spoke with San Jose Mayor Matt Mahan this morning. He's made some national headlines himself for homelessness proposals. There's some polling showing his proposal to compel people into shelter may be popular with voters. He said he appreciated your proposal here with the model ordinance. And he said your model ordinance in a lot of ways follows San Jose's approach really closely and does a lot of what San Jose is already doing. I know other cities have adopted encampment ordinances after grants passed, but did you take any inspiration from what Mahan and San Jose are doing?
Well, we took inspiration from the collective work of people that wrote that amicus brief. As you know, we led with that amicus brief. California joined on the grants pass, and we put out an executive order. And you go back to my executive order from last year, you'll see that framework that we advanced today. So look, I take inspiration from wherever we can find it. As a former mayor, I understand how challenging that job is, and I applaud any mayor for their willingness to lean in on this issue. And I'm grateful that there are a number of cities that have taken the state support, that have done a very effective job with those investments, and continue to want to do more and iterate in this space. And so I'm grateful that he and San Jose have adopted an ordinance and a framework around encampments, around notification, around personal belongings, about providing alternative strategies and opportunities to get people housed. We have the encampment resolution grants, as you know, $750 million the state has put out in that space. The dollars didn't exist in the past, also to help assist getting people off the streets and sidewalks in the first place. And I believe success leaves clues. And I think one of the good things about this state is mayors, cities large and small, share best practices, but we have to call out those that aren't even engaging in this conversation and somehow think it's someone else's responsibility, not just on homelessness, but on housing as well.
Governor, we'll have time for two more questions. The next two in the queue, the first one is from Janie Har with the Associated Press. Janie, please unmute yourself.
Hi, Governor. Thank you for taking our questions. So you've been telling local governments for years that they need to do more. And I'm wondering if you could give us an idea of, just what percentage of the state is dragging its feet on doing things to do with homelessness and housing? How many cities and counties have you moved since you have, started telling them that they are responsible and accountable for receiving some of the state money? Can you give us an idea of that?
We have one of the things that I've really come to enjoy, again, particularly, forgive me for being redundant, wearing my former hat as mayor, is spending time with mayors and comparing how their strategies and engaging with them in a collective group, talking about what's working, what's not, what they need, and what we need to do better going forward. I had a tough meeting, and this puts into context, I think, your question, and I'll get more specific in the response. It was a number of years ago. I rejected, and by the way, for the first time, we require strategies for the dollars the state provides with discretion. We require a plan in response, or in return rather, to those dollars being distributed. I received those plans and I rejected the plans. The mayors were not particularly pleased. We had a very large meeting. There were a number of press conferences, competing points of view about the merit of that approach. They came back with more ambition. We were very specific, to your question, in working with specific cities, counties, and what we refer to as COCs around areas where there was weakness and what we wanted to see in terms of improvements. And so we had a detailed engagement with those that we feel lacked ambition and weren't producing the kind of results, or weren't even proposing to produce the results moving forward. Those plans came back, they were significantly improved. And as a consequence, we began to improve our collaboration in this space. But I've also been very, very, very focused and very honest with my friends that are running these cities, large and small, that I wanted to see a renewed vigor and focus on what's happening on the streets, tents and encampments. It simply cannot continue. It cannot be a way of life, living out on the streets, in sidewalks, in what are almost become permanent structures, impeding foot traffic, impeding our ability for our kids to walk the streets in strollers, or seniors with disabilities and wheelchairs, even navigating their sidewalks. We cannot allow that to continue. And so last year, we dialed up the requirements as it relates to our plans further. We are in dialogue with the legislature to go even farther still. We created this homeless component into our housing enforcement wing, and we have been very explicit on the expectations as it relates to encampments, not least of which in the announcement today, but announcements late last year. And I've also demonstrated a personal commitment to cleaning up these encampments, physically out there. Many of you have joined me at these encampments so we can walk our talk. I'm not just trying to preach and sell down this vision. I'm trying to support that vision and be accountable to it as well. So look, I just think you deserve, it's my humble opinion, more and better results. And I am doing all I can to use my formal authority as governor to work in partnership with the legislature to create new rules and criteria in relationship to that, but also moral suasion here. The humanity, it is not human to step over people in the sidewalks and streets. It's not human to allow people to live 3, 4, 5 years in encampments. It's not human to allow the status quo to continue. And so again, moral and formal authority we're trying to exercise here.
The final question we'll have time for today is from Lindsay Holden with Politico. Lindsay, please unmute yourself.
Hi, Governor. I just wanted to ask, in terms of the model ordinance your office released today, it's kind of a two-part question. Why release that if there's not going to be any teeth in it to require governments to use it? And then also, are you setting up to use that as to attach that to HAP funding as a condition when you're negotiating with the legislature over that money? Is that why you're releasing it? Yeah, go ahead.
I'm just not interested in the status quo. We want to see this model ordinance across the state of California. We want to see how quickly communities that have not adopted a local ordinance adopt it. We want to right size some of the other ordinances that may be outliers and make sure that we're all sort of organizing with some basic expectations. We want people to customize their strategies, but we want, yes, sort of implicate, I'm walking down the path of that second part of your question. We're also previewing expectations moving forward in terms of what we've been saying privately to cities and counties and our mayors, and to what now we're socializing much more publicly with much more, I think, with higher level of expectation. And I'll close on this because we'll have a chance to talk a little bit more broadly about all these component parts on Wednesday when the budget's released. There's just simply never been more support in more categories to actually produce the results that the taxpayers deserve. And so it's an expression of a deeper sense of clarity and I hope understanding that I'm trying to communicate between local government that ultimately is responsible for delivering these results and the state. That the state has done unprecedented work to have your back, and now it's time to produce unprecedented results. We've made progress. 0.45% unsheltered is basically flat, substantially better than we've seen in some time, but that is not good enough. We want to see real reduction in unsheltered homelessness in the state. This is a framework in the application of how to do it in a way that we think is responsible, that is in the spirit of what we were trying to achieve by addressing the barrier that was Boise Grants Pass and why we did the amicus brief, with all the supports that have come through these unprecedented investments in encampment resolution grants, that's above and beyond HAP, and now behavioral health, where we're flooding the zone with these large-scale regional projects, to the conservatorship reforms, again, care court, and all of the other unprecedented effort to have the backs of local government and leaders to address the issue that defines more anger and frustration with Californians than any other, and that's what the hell is going on our streets and sidewalks. Thanks, everybody, for the opportunity to share this, and again, to the spirit that started this conversation on support, and particularly for those that are most vulnerable, humanizing mental health, humanizing, not criminalizing those with drug and alcohol addictions. This is a deeply meaningful day in the history of California's investment in this space, and I couldn't be more proud of the work that our team did in getting this done as quickly as they have. And now we're on to the next phase with local government, and we'll have their back as long as they have yours and they implement and get these permits done as quickly as they possibly can. Thanks, everybody.